Okay, he talked about CBC. So the complete blood count includes your erythrocytes, red blood cells, which are usually 4 to 6 million. You guys have to know, you guys got to memorize these values. Hemoglobin, which is a protein that attaches to O2 to the RBC, it's 12 to 18. Men are usually in the higher half of these values that I'm giving you. Women are in the lower because, we're not the same. Hematocrit is the percentage of RBCs, and it's usually 37 to 52%. Platelets are known as thrombocytes. Make sure you guys know thrombocytopenia or thrombocytosis. And the normal value is 150,000 to 400,000. You have to know what the patient's at risk for if they have a lack of or too much of these cells. So make sure you guys know that too. Your white blood cells are called leukocytes. Normal value is 5,000 to 10,000. You have leukopenia or leukocytosis. And then a CBC with differential. This is when the doctor orders a more focused look at the very types of white blood cells, which are neutrophils, eosinophils, basophils, lymphocytes, and monocytes. And so your neutrophils are composed of about 55 to 70% of all your white blood cells because it's your bread and butter. They usually are active during bacterial or fungal infections, which is what we have in our environment. Then your lymphocytes, these are the shot callers, by the way, but they compose only 20 to 40% of all your white blood cells. You have your monocytes, 2 to 8%, eosinophils, 1 to 4%, and your basophils, 0.5 to 1%. And this right here tells you exactly what they do. So your neutrophils, they are responsible for dealing with bacterial or fungal infections. These are most common first responders to microinfections. It's true. This is why when someone is like on chemotherapy or they have any issues with your neutrophils, you put them on neutropenic precautions. You can't give them fresh fruits, you can't give them flowers because they're going to be at risk for infection because their body can't even fight that stuff off. You have your eosinophils. These are dealing with parasitic infections and allergic reactions. Your basophils deal with allergies as well, and they release, doesn't say it here, but they release heparin, which is important for you guys to know. Lymphocytes, they include B cells and T cells, and your monocytes are responsible for phagocytosis. Your monocytes actually leave your vessels, and when they go into their tissue, they become phagocytes, and they kind of eat any cellular debris like Pac-Man. So make sure you guys memorize these values and what each of these are responsible for attack or for fighting off, because you'll know that if it's elevated, then that's what the infection is about.